Hi, you see this feedback up here? Let's talk about it in some few minutes. Hi, my name is Chantel. I talk about OSCE and other stuff. So, um, if you are preparing for your OSCE, don't forget to like and share this page so that we can grow together and prepare adequately to go and write the exams. Over the years of teaching OSCE, I've come across that many candidates make this simple mistake and that costs them dearly. We know that during your A to E assessment, where you are going to assess your patient and then document your vital observations on the NEWS-2 chart. After that process, you need to calculate what you call the NEWS total of the patient, which in turn influence the monitoring frequency. That is the frequency at which you will be monitoring your patient vital observations. And there's a clear-cut criteria for scoring or giving the monitoring frequency based on the NEWS total. So, according to the UK NMC or the system of the NEWS scoring, it's made in such a way that if your NEWS total is equal to 0, then the monitoring frequency should be a minimum of 12 hourly. It goes on to say that if the NEWS total is 1 to 4, then your monitoring frequency should be a minimum of 4, 5, or 6 hourly. So as per your discretion as a nurse associate, you need to choose the frequency at which you need to monitor your patient vital signs. So if the NEWS total is between 1 and 4, then you can go for either 4 hourly, 5 hourly, or 6 hourly monitoring interval. Then it goes ahead to say that if your patient is scoring as 3 in a single parameter, then it's devoid of the previous criteria, which says 1 to 4 is 4 to 6 hourly. Then it comes back to hourly. I take it again. If your patient is having a single parameter among the vital observations scoring 3, regardless of the fact that your patient's NEWS total is even 4, the monitoring frequency is hourly and not 4 to 6 hourly. Let's use this case scenario. You have a patient who is having a blood pressure systolic scoring 1, temperature also scoring 1, and then the respiratory rate also scoring 1. Therefore, other parameters are scoring 0 in this case, which makes the NEWS total 3. In this case, the monitoring frequency of this patient should be 4 to 6 hourly as per the criteria. However, let's take into consideration this scenario. You have a patient scoring a respiratory rate of 28, which will give us a NEWS score of 3. And then temperature is also scoring 1. All other parameters are scoring 0. In this case, the NEWS total of your patient is 4. Under normal circumstance, the monitoring frequency should have been 4 to 6 hourly. However, according to the criteria, if a single parameter out of the vitals is scoring 3, which in this case, respiratory rate 28, breath per minute is scoring 3, it devoid the previous rule, which says 4 to 6 hourly, then it takes up the new rule of hourly. So therefore, if you meet or on your test day, if your NEWS total is 4 or 3, but one parameter is scoring 3 out of that total 4, then the monitoring frequency should be hourly and not 4 to 6 hourly. This is a very common mistake that is costing candidates dearly. Most people fail assessment just because of this. Don't be the next victim. Make sure you share this video to anyone who is preparing for OSCE and even on the clinical setting so that we can know how to monitor our patient's vital signs and escalate to the appropriate team on time for safe and better patient care. Thank you.